You're trying to eat healthy, you have grapefruit for breakfast, you take your morning pills. You think you're doing everything right, but what if that innocent piece of fruit just turned your medication into something your doctor never prescribed? After 60, one common fruit can silently multiply the strength of your medications by 300%. And most people have no idea. By the end of this video, you'll know why grapefruit can dramatically alter how medications work in your body, which common medications are affected, including statins, blood pressure, drugs, and more. 3 safer citrus alternatives you can enjoy without risk, and exactly how to check if your medications interact with grapefruit. Important. This is educational information only, not medical advice. Never stop or change medications without consulting your healthcare provider. Always talk to your doctor or pharmacist about potential food-drug interactions. Here's what most people don't realize. Grapefruit isn't just another citrus fruit. It contains unique compounds called furanocoumarins that block a specific enzyme in your intestines, an enzyme called CYP3A4. This enzyme is responsible for breaking down many medications before they enter your bloodstream. When grapefruit blocks it, those medications aren't metabolized properly. Instead of getting the dose your doctor prescribed, you might be getting 2, 3, or even 5 times that amount. After 60, this becomes even more dangerous because your body already processes medications more slowly. Add grapefruit to the mix, and you're creating a perfect storm for serious side effects. We're going to walk through the 4 medication categories most affected by grapefruit first. Then we'll cover safer alternatives and practical timing tips. Let's start with category number 4. Let's start with medication category number 4, certain antihistamines and anti-anxiety medications. This category surprises many people because you don't usually think of allergy or anxiety meds having food interactions. Some antihistamines, particularly fexofenadine, that's the brand name Allegra, can interact with grapefruit. But here's the twist. Unlike most grapefruit interactions, this one works in the opposite direction. Some evidence suggests that grapefruit may actually decrease the absorption of fexofenadine, making it less effective rather than more potent. More concerning are certain anti-anxiety medications in the benzodiazepine family. Medications like diazepam, also known as Valium, midazolam, or Versed, and triazolam, which is Halcion, can have significantly increased blood levels when combined with grapefruit. One clinical study found that grapefruit consumption increased blood levels of certain benzodiazepines by up to 300%, potentially leading to excessive sedation, dizziness, confusion, and increased fall risk, particularly dangerous for seniors. What most people miss is that even one glass of grapefruit juice can affect these medications. And the effect doesn't wear off in a few hours. It can last 24 to 72 hours because it takes that long for your body to produce new CYP3A4 enzymes, so who should be extra careful? Anyone taking benzodiazepines for anxiety or sleep, people on fexofenadine for allergies, seniors at risk for falls or confusion, and anyone taking multiple medications that cause drowsiness. What should you do instead? If you take these medications, avoid grapefruit entirely. For allergy relief, antihistamines like loratadine, that's Claritin, or cetirizine, which is Zartec, don't have the same grapefruit interaction. But always confirm with your pharmacist before switching. And here's an important caution. Never stop taking anti-anxiety medication suddenly, as withdrawal can be dangerous. If you've been regularly consuming grapefruit while on these medications, don't panic, but do schedule a conversation with your doctor to review your dosing and discuss safer alternatives. Now let's move to medication category number 3, immunosuppressants and transplant medications. This category is critically important for anyone who has had an organ transplant or takes medications to suppress their immune system. Medications like cyclosporin, the brand names are Sandimmune or Neoral, tacrolimus, which is Prograf, and sirolimus, also called Rapamune, are used to prevent organ rejection after transplants. They have very narrow therapeutic windows, meaning the difference between an effective dose and a toxic dose is small. Some research indicates that grapefruit can increase blood levels of these medications by 50% to 200%, potentially causing kidney damage, increased infection risk, or other serious toxicity. The danger here is that these medications require precise blood level monitoring. If grapefruit is silently increasing absorption, your blood tests might show levels that are dangerously high, requiring emergency dose adjustments. What most people miss is that even small amounts matter with these medications. A single glass of grapefruit juice, or even eating half a grapefruit, can affect drug levels for several days. Who should be extra careful? Organ transplant recipients, whether that's kidney, liver, heart, or lung, anyone taking immunosuppressants for autoimmune conditions, people on medications requiring regular blood level monitoring, and those with a history of transplant rejection. What should you do instead? If you take immunosuppressants, grapefruit should be completely avoided. No exceptions. There are no safe timing strategies because the enzyme blocking effect lasts so long. Choose other citrus fruits like oranges, tangerines, or clementines instead. Important caution. If you're on these medications and have been eating grapefruit regularly, contact your transplant team or prescribing doctor immediately. You may need blood level testing to ensure your medication levels are in the safe range. Do not adjust your medication dose on your own. Coming in at number 2, blood pressure and heart medications. This is one of the most common categories affected, and many seniors take these medications daily. Calcium channel blockers are a class of blood pressure medications that are particularly sensitive to grapefruit. These include amlodipine, which is the brand name Norvasc, felodipine or Plendil, nifedipine, that's Procardia or Adalat, and nizoldipine, which is Suler. Some evidence suggests that grapefruit can increase blood levels of these medications by 40% to 150%, potentially causing blood pressure to drop too low. That's called hypotension. This can lead to dizziness, fainting, rapid heartbeat, or even falls. After 60, this becomes especially dangerous because seniors are already at higher risk for orthostatic hypotension. That's a sudden drop in blood pressure when standing up. Add grapefruit-enhanced medication on top of that, and the fall risk increases significantly. Now here's some good news. Not all blood pressure medications interact with grapefruit. ACE inhibitors like lisinopril, ARBs such as losartan, and beta blockers like metoprolol generally don't have this interaction. What most people miss is that the interaction isn't just about grapefruit juice. Eating the whole fruit, the pulp, and especially the membrane between sections, contains even more furanocoumarins than juice. Who should be extra careful? Anyone taking calcium channel blockers for high blood pressure or angina, seniors with a history of falls or dizziness, people taking multiple blood pressure medications, and those with heart rhythm problems. What should you do? Talk to your doctor about whether your specific blood pressure medication interacts with grapefruit. If it does, ask if switching to a different class, like an ACE inhibitor or ARB, is appropriate. If switching isn't an option, avoid grapefruit completely and choose safer citrus alternatives. Important caution: if you've been eating grapefruit while on these medications and you experience unusual dizziness, rapid heartbeat, or fainting, contact your doctor right away. These could be signs of dangerously low blood pressure. Never stop blood pressure medications suddenly without medical supervision. And here's the number 1 medication category most affected by grapefruit: cholesterol medications, also known as statins. This is the big one. Statins are among the most commonly prescribed medications for seniors, and several types have significant grapefruit interactions. Statins affected by grapefruit include atorvastatin, which is Lipitor, simvastatin, or Zocor, and lovastatin, also called Mevacor. Some research shows that grapefruit can increase statin blood levels by 260% or more, dramatically raising the risk of serious side effects like muscle pain that's called myalgia, muscle breakdown, which is rhabdomyolysis, liver damage, and kidney problems. Rhabdomyolysis, though rare, is a life-threatening condition where muscle tissue breaks down and releases proteins into the blood that can damage the kidneys. Symptoms include severe muscle pain, weakness, dark urine, and extreme fatigue. Now here's some good news. Not all statins interact with grapefruit. Pravastatin, which is Pravachol, rosuvastatin, or Crestor, and fluvastatin, that's Luscol, are metabolized by different pathways and generally don't have clinically significant grapefruit interactions. What most people miss is that the amount of grapefruit matters. One small glass of juice occasionally might have minimal effect on some people, but regular consumption, even just one grapefruit every morning, can lead to significant drug accumulation over time. Who should be extra careful? Anyone taking atorvastatin, simvastatin, or lovastatin, seniors with a history of muscle pain or weakness, people taking high doses of statins, those with kidney or liver problems, and anyone on multiple medications metabolized by CYP3A4. What should you do instead? If you're on a grapefruit-sensitive statin and you love citrus, ask your doctor about switching to pravastatin or rosuvastatin. These statins are just as effective for lowering cholesterol but don't interact with grapefruit. If switching isn't an option, completely avoid grapefruit and grapefruit juice. Important caution. If you're currently taking a grapefruit-sensitive statin and have been eating grapefruit regularly, watch for warning signs: unexplained muscle pain, weakness, tenderness, dark or tea-colored urine, or unusual fatigue. Contact your doctor immediately if these occur. Do not stop your statin without medical guidance, as this could increase your risk of heart attack or stroke. So those are the 4 medication categories most affected by grapefruit: certain antihistamines and anti-anxiety meds, immunosuppressants, blood pressure medications, and statins. But here's the important part. You don't have to give up citrus fruits or your morning fruit routine. The 3 safer alternatives I'm about to share taste just as refreshing, provide similar nutrients, and won't interfere with your medications. Let's start with safer alternative number 3. Safer citrus alternative number 3. Oranges and orange juice. Oranges are the safest, most straightforward grapefruit substitute. Unlike grapefruit, oranges don't contain significant amounts of furanocoumarins, those compounds that block the CYP3A4 enzyme. Some evidence suggests that oranges and orange juice do not cause clinically significant interactions with the medications we've discussed. Nutritionally, oranges offer many of the same benefits as grapefruit. They're high in vitamin C. One medium orange provides about 70 milligrams, roughly 90% of your daily needs. They're a good source of fiber, especially if you eat the whole fruit rather than juice. They contain potassium, folate, and beneficial antioxidants, and they're lower in calories, about 60 calories per medium orange versus 52 for half a grapefruit. How should you use them? Swap your morning grapefruit for one whole orange, or drink a small glass, about 4 to 6 ounces, of 100% orange juice. If you prefer the slightly bitter taste of grapefruit, choose a blood orange or Caracara orange. They have a more complex, less sweet flavor. Here's a practical tip. Eating the whole fruit is better than juice because it provides fiber, which helps slow sugar absorption and keeps you fuller longer. If you do drink juice, limit portions to 4 to 6 ounces to avoid blood sugar spikes. One caution: orange juice, like grapefruit juice, is acidic and high in natural sugars. If you have diabetes, monitor your blood sugar response. If you have acid reflux or take medications on an empty stomach, citrus may cause discomfort, so eat or drink it with food. Safer alternative number 2, tangerines, clementines, and mandarins. These small, easy-to-peel citrus fruits are another excellent grapefruit substitute, and they're often sweeter and more convenient than oranges. Like oranges, tangerines and their relatives clementines, mandarins, satsumas, don't contain the problematic furanocoumarins found in grapefruit. They're safe for people on statins, blood pressure medications, immunosuppressants, and other grapefruit-sensitive drugs. Nutritionally, they're fantastic for seniors. They're high in vitamin C. One clementine provides about 35 milligrams or 40% of daily needs. They're lower in calories, about 35 to 50 calories per fruit. They're easy to digest and gentle on sensitive stomachs. And they're portable and require no preparation. Just peel and eat. How should you use them? Keep a bowl of clementines or tangerines on your counter for easy snacking. Eat 2 to 3 small fruits to replace 1 grapefruit. Add segments to salads, yogurt, or oatmeal for a burst of flavor. Here's a practical tip. Buy clementines in season. That's November through January, when they're sweetest and most affordable. Outside of season, look for mandarins or satsumas, which are available longer. One caution, these fruits are still sources of natural sugar. If you have diabetes, count them as carbohydrates, about 9 to 12 grams per fruit, and monitor your blood sugar. If you're watching your weight, stick to 2 to 3 fruits as a serving to keep calories in check. And safer, alternative number 1. Now, you might have heard about pomelo as a grapefruit substitute, but I need to give you some critical information about this. Pomelo is a large citrus fruit that looks similar to grapefruit and is often suggested as a substitute. But here's what you need to know. Pomelo is actually the ancestor of grapefruit. Grapefruit is a hybrid of pomelo and sweet orange. Because of this, some varieties of pomelo may contain small amounts of furanocoumarins, though generally much less than grapefruit. Some limited research suggests that pomelo may have a weaker interaction with medications compared to grapefruit, but the data is not conclusive, and individual pomelo varieties differ significantly. So here's the verdict. Pomelo is not a guaranteed safe alternative. If you're on medications that interact with grapefruit, it's safer to avoid pomelo as well, or at minimum, consult your pharmacist before trying it. Instead, here are better safe alternatives: lemons and limes. They're safe but very tart, so use them in water or cooking. Kumquats, these are small sweet tart fruits that are safe. And ugly fruit, which is a tangelo variety, it's generally safe but confirm with your pharmacist. Important caution. If you're on grapefruit-sensitive medications, don't assume that grapefruit-like fruits are safe without checking. Always ask your pharmacist or doctor before trying unfamiliar citrus varieties. The safest bet is to stick with well-studied options like oranges and tangerines. Now, let's talk about timing, because this is where a lot of people get confused. Many people believe that if they eat grapefruit in the morning and take their medication at night, or vice versa, they can avoid the interaction. Unfortunately, this is a dangerous misconception. Here's why spacing it out doesn't work. Grapefruit's effect on the CYP3A4 enzyme isn't about what's in your stomach at the same time as your pill. The furanocoumarins in grapefruit bind to and deactivate the CYP3A4 enzyme in your intestinal lining. Once that enzyme is blocked, it stays blocked until your body produces new enzymes, which takes 24 to 72 hours. Some research indicates that even a single serving of grapefruit can affect medication metabolism for up to 3 days. So what does this mean in practice? Eating grapefruit Monday morning can still affect medication you take Tuesday night. Drinking grapefruit juice at breakfast can interfere with your evening dose of statins. There is no safe time gap between grapefruit and medications. The only safe approach. If you're on grapefruit-sensitive medications, avoid grapefruit entirely, every day, not just on days you take your pills. So how do you find out if your medications interact with grapefruit? You don't need to memorize drug names or become a pharmacology expert. Here are 3 simple steps. Step 1. Read your medication labels and patient information sheets. Many prescription bottles and medication guides now include warnings about grapefruit. Look for phrases like, "Avoid grapefruit and grapefruit juice while taking this medication." Do not consume grapefruit products or may interact with grapefruit. Step 2. Ask your pharmacist directly. Pharmacists are the most accessible experts on drug-food interactions. Next time you pick up a prescription, simply ask, "Does this medication interact with grapefruit?" They can check your entire medication list in seconds. Step 3. Use reliable online tools. Websites like Drugs.com or Medscape have drug interaction checkers where you can enter grapefruit and your medication name. But always confirm findings with your pharmacist. Online tools aren't perfect. Here's a bonus tip. Keep a written list of all your medications, prescription, over-the-counter, and supplements in your wallet or phone. This makes it easy to check for interactions and share with healthcare providers. Now, what if you absolutely love grapefruit and you can't imagine giving it up? If grapefruit is a beloved part of your daily routine and you're on a grapefruit-sensitive medication, you do have options. For many medication classes, there are alternatives that don't interact with grapefruit. For statins, the grapefruit-sensitive ones are atorvastatin, simvastatin, and lovastatin. The grapefruit-safe alternatives are pravastatin, rosuvastatin, and fluvastatin. For blood pressure medications, grapefruit-sensitive options include most calcium channel blockers like amlodipine, nifedipine, and felodipine. Grapefruit-safe alternatives include ACE inhibitors like lisinopril, ARBs like losartan, and beta blockers like metoprolol. Talk to your doctor. Explain that you regularly consume grapefruit and ask if switching to a non-interacting medication is appropriate for your health needs. In many cases, the alternative medications are equally effective. But here's what's important. Never switch medications on your own. Some switches require dose adjustments, monitoring, or may not be suitable depending on your specific health conditions. Let's summarize the most important points. Takeaway number 1. Grapefruit contains furanocoumarins that block the CYP3A4 enzyme, causing some medications to reach dangerously high levels in your blood. Takeaway number 2. Common affected medications include certain statins like atorvastatin and simvastatin, calcium channel blockers like amlodipine and nifedipine, immunosuppressants, and some anti-anxiety medications. Takeaway number 3. Timing doesn't help. Grapefruit's effect lasts 24 to 72 hours, so eating it in the morning still affects evening medications. Takeaway number 4. Safe alternatives exist. Oranges, tangerines, clementines, and most other citrus fruits don't have this interaction. And takeaway number 5. Always check with your pharmacist. They can review your entire medication list and confirm whether grapefruit is safe for you. So there you have it. Grapefruit isn't dangerous on its own. It's a healthy fruit packed with nutrients. But when combined with certain medications, it can create serious, sometimes life-threatening complications. And after 60, when most of us are on multiple medications, that risk becomes very real. The good news, a simple conversation with your pharmacist can protect you. A switch to oranges or tangerines can let you enjoy citrus without worry. And knowing which medications are affected puts you in control. Now I want to hear from you. Did you know about the grapefruit medication interaction? Are you on any of the medications we discussed? And will you check with your pharmacist this week? Drop your answer in the comments below. I read everyone and reply with personalized guidance. If you found this video helpful, hit the like button and subscribe to It's Better Health. We're building a community where seniors don't just take medications, they understand them and use them safely. And remember, your health is a partnership between you and your healthcare team. One informed question can save your life.